Hi, my name is Emily Hoyt, and today we will be performing some x-rays on our patient here. Our patient's name is Simba Jensen. He is a neutered male Labrador Retriever. He is yellow, obviously, and he weighs 24.5 kilograms. So for the machine that we'll be using today, we'll be using a computed radiography digital cassette system. So as you can see here, we have our tabletop. Fortunately, I only have a round table, so usually it would be rectangular, so just imagine it for today. Then we have our x-ray head. We have our anode and our cathode ends in our tube head, and then the arm that hangs above the table. This is our cassette that we will be using for our x-rays today. So once you've taken your image, you'll insert it into the machine and it will scan the photosimul phosphor imaging plate that's inside your cassette, and then it will electrically transfer the signal to the computer. So computed radiography uses the same machine as digital radiography, which includes the photosimul imaging plate. In the scanner, the imaging plate is scanned by helium neon laser beams, and then that's when it releases the light and produces an electrical signal to the computer. One advantage of this system is there's less retakes due to incorrect exposure factors, and one disadvantage of this system is the initial cost. You need high quality monitors, software matrix with small pixels. So for our cassettes, this is the cassette that we'll be using today for our x-rays. It's very important to make sure that you erase the image before taking a radiograph, because these images can store, like once you take a radiograph, there might be stored images left over on the plate if it's not erased before using it. It's super important to make sure that you are developing the radiograph as soon as it's shot, because these images are only stored on the plate temporarily and it will lose 25% of image in less than 8 hours. So you need to make sure that you're reading it within a few hours at minimum. So on our x-ray tube head, there is both an anode and a cathode inside the tube head. So the anode is always positive and the cathode is always negative. A way that we can use this in effect while taking x-rays is because the intensity of x-rays increase toward the cathode side of the beam. So when we're positioning for x-rays, we can put the thickest portion of the body more towards the cathode end, and the intensity of the x-rays will be able to go through the thickest portion. So for our safety gear when taking x-rays, we have an apron that's going to cover your whole front of your body. Dense lead stops weak x-rays and scatter, and you're going to want a minimum of 0.5 millimeters in all of your gear. So it should clip in the back there, should cover your front. Then you'll have a thyroid collar that should go around your neck. And then you will also have gloves. And that is all the safety gear that everyone should be wearing when they're in a room. So another way that you can decrease your exposure to radiation while taking x-rays are using positioning aids like gauze, tape, or a V-trough. When taking abdominal x-rays, you can use a V-trough, placing the animal on its back inside the V-trough to stabilize it and keep it center. You can use gauze to tie around the limbs to extend them. Instead of having your hands under the x-ray, you can have gauze pulling them, extending them. And then you can use tape if you're needing to manipulate the limb or joint a certain way. You can tape it to hold it right into place so that your hands aren't having to hold it. So one way that we can measure our exposure to radiation when taking x-rays is called a TLD, also known as a thermoluminescent dosimeter. These are chips that are altered electrically by radiation. You should be wearing it anytime you're in a room. Being exposed to radiation, always have it on you. You're going to want to make sure that you are wearing it on your waist level, underneath your apron, and storing it in a dark area or a room. Alright, so for our first position that we will be doing, it's a right lateral elbow with a 90-degree joint flex. So first we're going to position our patient into right lateral, which will be on his right side. Then we'll get our plate and we'll place that underneath the right leg, and then get your right marker, and I'm going to place that right about there. So it won't come in contact with the bone or anything or be behind the leg, but it will make sure that it is in the shot there. So first thing you're going to want to do is you're going to want to measure the thickest area. So in this case, it'll be the distal humerus. So the elbow's here, so it'll be measuring around here. Elbow will be here. We will want to center our beam, so we'll want to have our cross right along the elbow here. And then for our collimation, be around that much, not too wide, so that we're not causing any excess scatter x-rays or anything like that, but just enough to get the full label and the leg in the view there. So once you have the collimation set, everything is measured, and everything like that, we will want to make sure that we position our patient so we're ready for the x-ray. So for this x-ray, we'll have the right leg that's down at a 90-degree angle, so nice and straight there, and then the opposing leg will need to be pulled right out of the way, and then as well as the head. So we need to make sure that we're not getting the opposing leg and the head, but only getting this area of the right leg. Alright, so for our second shot, we're going to be doing a right craniocaudal elbow. So we're going to want our patient in sternal recumbency, and we are going to be wanting, our plate is going to be placed on the right and front leg. So for this position, you need to be careful with the head. Over rotating it can move that joint around. So you want to make sure the head and the opposing leg is out of view, but we need to make sure that we are not pulling it too much, that the joint is being rotated too much. So both those need to be out of the view. When we measure for the thickest area, it's going to be the distal part of the humerus, and you're going to want half the humerus in the shot, the olecranon, and then half the radius / ulna as well in view. We want to make sure that our marker isn't behind the leg, but just beside, making sure that it's still in view. And then for our collimation, we're going to want to collimate it down to about here, so it's still getting that marker, and then also the leg, but also not getting the excess around the leg. Okay, so for our next view, we are going to be doing a left caudocranial humerus view. So for this view, the patient will be in dorsal recumbency, so on their back. We will be pulling our front legs cranially, and ensuring that they're staying straight as possible. For our plate, we're going to place under the left side. We have our marker here, and we're also going to place that just about right there. We want to kind of manipulate the body so that we're kind of pulling our leg away from the rib cage, but also not enough that it's rotating that joint. So we're gonna kind of pull it away like that, pulling this one straight, this one a bit of ways. And then for our points, we're gonna wanna make sure that we're getting the olecranon, the full humerus, and then just the beginning of the scapula up here. So you're gonna wanna get those in the shot, and then you're trying to avoid getting that rib cage in there as well. So that's why you're trying to pull that joint away. You're gonna wanna be putting your marker just in the middle of the humerus there. Or you're gonna wanna be putting your cross just in the middle of the humerus there. Okay, and for our last position for our front limbs, we will be doing a left lateral carpus and phalange shot. So for this view, the patient's gonna be in left lateral. So always the affected side down. So left side will be down. So we're getting the phalanges and then the carpus. So this is the carpus, here's all the phalanges. So when positioning for this kind of shot, your plate will go under. We'll put our marker right over there. So you're gonna wanna pull this leg out of the way, keep this leg straight. When doing this type of view, you can use positioning aids, like a wooden spoon. You can use tape to separate the phalanges to make it easier and your fingers aren't getting in the shot. But where you're going to want to make sure you're getting is you're going to want to make sure you're getting the accessory carpal bone, the carpus, and then all the phalanges down at the bottom. And you're gonna wanna collimate down to carpus. And then just beside the phalanges there. Shot is the left caudocranial tibia and fibula. So what position your patient is going to be in for this is going to be sternal. So we'll position our patient sternal. And this is the left side of our patient. So we will get our left marker and take our plate, put it right about there. I'm gonna put the left marker about right there. You're gonna want to straighten the leg out here. This other leg needs to be put out of the way. This one needs to be positioned on the plate. Your beam is going to go in the center of the tibia. You're going to want to measure at the thickest area of the legs. That's going to be the tibia and the fibula. You're going to measure there. And then when we collimate down, we're going to want to collimate down to about here. So you're still getting in the rest of the leg there, but mostly focusing in on this area. And our points where we're going to want to get is we're going to want to get the femur and the patella, and then you're going to want to get the tibia and the fibula, and then also you're wanting to get some of the tarsus in there as well. So collimating down to just those sections, and then just right there, and then enough to also get your marker in there as well. All right, so for our second position for our hind limb shots, we're going to be doing a right stifle. So the patient will need to be in right lateral. So we will position our patient to right lateral. So this is our patient's right side. So we're going to come down like so. Make sure that we're getting our right marker. Get our plate, flip it that way. All right, and so with the opposing leg, it's going to go upwards so that our right leg there is the only one in shot, and we're just gonna abduct this away like so. For our landmarks, we want to be getting half of the femur, half of the fibula tibia, and then of course the stifle joint, and then also as well the patella. For our collimation, we actually are going to collimate down. So we're actually cutting off a little bit of this leg. So we're mostly focusing in on this stifle joint there. So we can actually cut off right there and then collimate down to about there. And then as well getting half of the tibia and fibula as well. So just the tibia fibula and then about right there. So we'll collimate down to there. We'll measure our thickest area. So we're going to want to measure at the stifle joint here. That would be the thickest area for this position. And yeah, and then just making sure that you're getting everything out of the way except for that joint there. Okay, and so for our third view for our hind limb shot, we're going to be doing a VD frog leg pelvis shot. So for this position, your patient will be on their back, so in ventral dorsal. So we'll position our patient, and then you would also make sure that you're pulling the front legs out of view. For our plate, we slide it under the pelvis here. And we want to make sure that we're getting our patient as straight as possible. We want our wings of ilium to be perpendicular, nice and straight. So that's where we would use positioning aids, like you could use a V-trough, as long as it doesn't go beyond here, but maybe a smaller one up here to kind of stabilize the body. And then you're gonna put a marker on whichever side he is on. So this is the left side, so we'll put the left over here. So for this position, it's a frog leg position, so it's supposed to be relaxed. This is usually used if a fracture is suspected. So we're not pulling the legs, but we're kind of just letting them sit how they normally sit. And for our landmarks, we are going to go from the top of the wing of ilium, including the 7th lumbar vertebrae as well. And then we're wanting to get half of the femur in, so we'll say that's the top of the wing of ilium, half of the femur, and then for the bottom where you're going to want to collimate down to is down to the ischium. So on here, here, here. So it's kind of a nice little rectangle there. For the center of our beam, we're going to want it in the middle of the pelvis. So the ilium bones, most likely in the middle of the ilium bones there. When we are measuring for our x-ray, we want to, of course, measure at the thickest area. So we measure at the top of the wing of ilium. So you measure on the belly and then on the back as well. So you measure there and take this measurement. Okay, and for our final position for our hind limb shot, we're going to be doing a left dorsoplantar torsus shot. So for this position, you can either do it in sternal or sitting up. I'm going to do it in sternal. So put the patient in a sternal. What you're going to want to do with the left leg is you're going to pull it actually cranially. So you're going to pull this more upward. Get our plate. And then also we want to make sure that we're getting our marker. We're going to want to try, we can also use aids to help move the body up so that we're not superimposing the joint here. Because we also want to try and keep it as straight as we can, but we don't want to over-rotate that. So for our landmarks, we're going to get the tibia and fibula, tibia, fibula, and then we're wanting to get the calcaneus, and then of course the tarsus, and then the metatarsals. And you're gonna want to focus your beam on the tarsus, and you're gonna want to measure at the thickest point as well, which would be the tarsus. So we'll say it's right there. So you want to measure that as well. When you are doing your collimation, you're gonna want to make sure, so get our left marker in there, but we're gonna want to do about there, and then getting the metatarsals in there as well, and then just where the tibia and fibula meet up with the calcaneus, so about right there, focusing in on the tarsus in the middle. So that's where the center of your beam is going to be. Ventral dorsal recumbency. So on their backs, our plate will be, it would typically be a little bit bigger than this, but it'll go down a little bit so that it's right at the wings of ilium down, because we have to get the patellas in. Put this on the left side here. Front legs would be pulled out of the way. So the back legs will be extended caudally until they're parallel to each other and the table. You're gonna wanna rotate your stifles medially, so the patella is centered in the trochlea. So you're gonna wanna pull, but then you wanna kind of use your hands and your wrists to twist them like so. So they're rotated in like that. And then you wanna extend them out. So rotate and extend. The pelvis must be symmetrical. You need the foremins to be symmetrical. You need the wings of ilium to be parallel with each other, and you need your spine straight and aligned. So our points here where to collimate is you need to collimate to the wings of ilium at the top. So you need to be here, and then you need to be down to the stifle joint. So we'll say this is our stifle joint. So go here and here. All right, so that would be where we would collimate down for this position. And then making sure that you're pulling your legs medially. Where we'll measure for this shot is at the thickest point. So we'll measure right, same spot as the frog leg position. We'll measure right here at the wing of ilium, so be on your stomach and then on the back, and then you'll take this measurement here because that would be the thickest area for this position. Where we'll center our beam for this position will be right in the middle of the shot. So right where the femurs enter in and right where the obturator foramen. Lateral thorax shot. So for this shot, the patient will need to be in left lateral recumbency. So flip our patient into left lateral. So the left side is down and the right side is up. And then we'll get our plate, position that as well. And then we'll have our right side marker. Until we're down here into our shot as well. So when positioning for this shot, we want to make sure that our front limbs are cranial, so there's no super in position. So we want to pull our front legs cranial, and then we can also, if we want, we can also elevate the sternum with a wedge so that there's no tilting as well. For our landmarks for this shot, we're going to want to do the cranial end of the thorax down to the diaphragm, So you're just getting the diaphragm and then the cranial portion of the thorax in the shot. You don't want to get any of the abdominal area in the shot as well. So when we measure for our thickest area, we are going to measure right here. This would be our thickest, so we'd be measuring here and then on the bottom and then taking that measurement there. When we do our collimation, like I said before, we want to collimate to the cranial aspect of the thorax down to the diaphragm, and then we'll want to leave some room just on the sides, but not too wide, so there's not any scatter x-rays, but just enough, so about right there. For the center of our beam, we are going to want to put it in the center, so right about where the heart would lay, which is where about the middle of the thorax would be. When we look at our machine here, the cathode end, like we mentioned before, is the end for the thickest portions of the body. So we would want to put our thickest portion right here more towards the cathode side so that it will have a greater intensity to go through. So when we are doing the left lateral thorax shot, typically the left lateral is actually not as common to do rather than a right lateral. And that reason would be because on the left side is where your heart is. And when you're doing a left lateral, your heart is actually not being as exposed. So when you're doing a right lateral shot, your heart is right closer to the surface there. So you're wanting to get the trachea, the esophagus, the lungs, the heart, the ribs, the sternum, the vertebrae, and the diaphragm. And when we are doing that in right lateral, it is much clearer to be able to see all of those individual organs. Okay, so next position we'll be doing is a VD thoracic shot. So for the VD, the patient will be in dorsal recumbency. So position our patient on their back. Please. So you're going to want to pull make sure your patient's very straight. You're going to want to pull your front legs cranially, and then obviously your back legs caudally. We'll mark our left side. So this is our left side on our patient. Put that in there. So what you're going to want to be getting for this shot is you want to make sure that you're getting the cranial aspect of the thorax all the way down to the diaphragm. You want to make sure you're getting the scapulae in the shot, the dorsal spinous process as well. You want to make sure you're getting the caudal vena cava. And you have a very nice image of the heart as well. So the center of your beam should be where the heart is. And then you're going to want to measure at the thickest area, which would be right at the sternum here. So you'll measure at the sternum, behind, and you'll take that measurement there. And then your collimation will be set to, like I said before, the cranial aspect of the thorax, and then down to the diaphragm, and then pulling those arms as much out of the way. You want to get about right there. So you're still getting, so you're able to get all of that extra area, the diaphragm, but you're trying to pull those arms as much out of the way there. All right, so for our next position, we're going to be doing an abdominal right lateral. So for this, our patient will need to be in right lateral recumbency. So place our patient, this is our right side and this is our left. So we'll place our patient in right lateral. Taking advantage of the cathode end with our heel effect, we'll want our patient more towards, we want the thickest part. So the thickest part would just be right along the stomach here. So you'd measure this side, and then you'd take this measurement here. Place our plate under. And since the left side is up, we'll want our left marker. We're going to put that there. So when positioning for this, you want to make sure that you're pulling your back legs caudally and your front legs a bit cranially. So it's more like that there. For our landmarks for this shot, we want to start at the diaphragm. We'll say that's the diaphragm there. And you want to get all the way down to the bladder. If it's a female dog, you're going to want to make sure you're also able to get the uterine tract evaluation as well. So there to there. We'll collimate down, like I said, to the diaphragm, all the way down to the bladder, female, as well as the uterine tract. And then we'll also want to get about right there. So that's for our collimation. Our center of our beam will be placed right in the center of our abdomen here. All right, so then for our second abdominal shot, we'll be doing a DV abdomen. So our patient's already in DV. Our hind legs will be extended caudally, slightly. And then for our landmarks, and then also, of course, our front legs also extended cranially. For our landmarks, we'll be wanting to get the diaphragm down to the pelvic floor. So those will be our landmarks there. So say our diaphragm's here down to about here. So we'll collimate down to there, and then collimating about there. For our marker, this is our left side, so we put our marker down on our left side there. Center of our beam would be, we're focusing more in the abdomen, so it'd be just in the kind of cranial abdomen there. And then measuring as well at the cranial abdomen, because that would be the thickest area. And then taking in effect the heel effect as well, taking that in mind, positioning our patient more towards the cathode. And so he's already positioned more. Okay, so our next shot is going to be our vertebral shots. And our first one is a right lateral thoracic shot, since you need a couple of different shots for this one. So we'll need to put it into right lateral recumbency. So patient is on his right. And our plate is going to be right there. So measuring at the thickest area, this would be the thickest, right kind of in the middle of the thoracic spine. So you'd measure here, more kind of on the abdomen there. And then for our landmarks, we're going to want to make sure we're getting in T1. So we'll say the scapula is here, so T1 is about right there. And then we're also going to be getting 3 to 5 vertebrae after that. So third T1, and then you do in those sections. So we'll go about there. So we'll have 1, 2, 3, 4, 5 in our shot. And then collimating down as well. We're really just focusing in on the vertebrae. So we would collimate down, say about there. So we're still only getting that vertebrae in there. Put our marker down for our left side. With this position, you can also use wedges or aids to kind of lift up the body so that it's not so rotates more straight that way. For the thoracic shots, we would need to do a couple since it's pretty long here. So then our next spot would be about here, we'll say, because then we still need to get our other section. So we'll say our next shot will be here, collimate down to there. And for our landmarks there, we are going to be getting in the So for our second shot for the lateral, we'd want to move over here so we're getting it more on the cathoid end. And then you want him probably to get there another 3 to 5 vertebrae after that. Call me down to there. So we want to do a couple shots for our thoracic vertebrae. For the beam, for centering the beam, we're going to want to, so for the first one, we're going to want to center it just in the middle of the vertebrae there. And then same thing for the second shot as well, also in the middle as well. All right, so for our next shot, we'll be doing a VD sacrum for the vertebral shots. So our patient's already in VD, our plate is already positioned, our marker is on his right side there. So for this position, we're really focusing in on the sacrum, and then also as well getting L7 and L6 in our shot as well. So we'll say this is the sacrum here. So then we're focusing also getting in L7, L6, and then as well as the coccygeal vertebrae as well in there a bit. But for our landmarks, we'll get L7 down to the end of the ischium. Down to the end of the ischium, L7, and then also getting in the pelvis there. So our collimation will be set there to about there. Center of our beam will be on the ischium because that's where we're focusing in more on. When we measure, we'll measure at the thickest part. So the thickest part would be where the pelvis starts. So we'll measure at the pelvis to the back and then get that measurement there. And then of course, we will also want to move our patient where the thickest area is to the cathoid end for our heel effect. So our patient's already, this is the cathoid end, so it's already positioned pretty close to there. So the thickest area, so we would keep him at this spot and not move him this way, keep him on this end. Okay, and then for our right lateral TL junction, our patient's in right lateral, the plate is underneath our patient, right there. And then we'll have our left marker up here. So for the landmarks for this one, it's the T13 junction down to the L1 disc space. So we'll say this is T13 here, so we do that junction down to L1. So that's where we would collimate down to, and then also collimating down to about there as well, just getting that junction there. Measuring at the thickest part, we would measure the center of the abdomen there would be the thickest. And then our center of our beam would be at the T13 junction, kind of where we're focusing in on. So that's where our center of our beam would be for this shot. And then of course, positioning, just holding those legs out of the way there, ensuring our body is nice and straight. We can also use a wedge to make our body lift up more so that we're more straight and parallel. When taking the heel effect into consideration, since our thickest area is about the abdomen there, we would move our patient more towards the cathoid end so that the thicker abdomen area would be towards cathode. All right, so then for our fourth shot we'll be doing for the vertebral shots, we'll be doing a VD lumbar spine. So for this position, our patient will be ventral dorsal, so on their back. Our plate we will put right there. And then for this position as well, we want to make sure that we're pulling the front legs cranially so you can tie them and pull them up or hold them up, but they need to be pulled up. Back legs, we just need to manipulate them so that our body is staying as straight as possible for this shot. So we can also get sandbags, V-trough, whatever, to make sure it's nice and straight, but we need to make sure our legs aren't wobbling around so we can get a nice straight shot. For our landmarks, it's going to be the T13 junction down to the kind of the top of the pelvis there. So we'll say T13 junction is there, top of the pelvis is here. So you'll get 3 to 5 vertebral shots in there. And then for our measurement, we'll want to measure to the thickest area. So thickest area would be just on their abdomen here. So you'll measure here, here, and then get that measurement there. And then for the center of our beam, we'll want to center it kind of just in the middle of the spinal process there. So So for our center beam, we'll go at around L4, just because that's probably around the center of the spinal process there. For collimating, we want to collimate fairly down to about there, so we're not getting the whole abdomen, but mostly just focusing in on the spine. And then, of course, just getting just where that spinal process of the T13 and then down to the L7, kind of just above the pelvis there as well. And then also making sure you have your marker in. So the right side of this patient is just right there. All right, so then for our second last vertebral shot, we're doing a VD coxageo. So position our animal in VD. Put our plate just where the tail is. Oh. Put our marker, that's the right side. All right, so for the center of the beam, we want to put it over the area of our interest when we're x-raying this tail, and then for the measurement, we're gonna do it at the proximal tail. So measure at the proximal tail. For our collimation, we'll want to get about just before the tail there. Sorry, my guy's falling off the table. Just before the tail there, and then to the end, and then also just collimating down to there. Here. So for our last vertebral shot, we're going to be doing a right flexed cervical spine shot. So our patient's already in our right lateral that we need them to be. The plate is already positioned underneath the neck, and then we have our left marker there for us. The patient's already moved closer towards the cathode end. I don't have enough room on this side, but ideally we would want the thicker area towards the cathode, and the thicker area would be right around the middle of the neck there. So for this position, for the flex position, you pull the neck. You can also use positioning aids as well to kind of put underneath, inside the mouth on the jaw, and you pull, you flex the cervical spine like so, like that. And for our landmarks, we're gonna want to get the atlas all the way down to C7. So you'll also be getting about half the scapula in as well. So we'll say that to about there. You want to make sure that you're not superimposing the scapula on C6. So trying your best not to overlay those two, but you go about there. And then for our collimation, you're just focusing in on the spine there. So you collimate down to about there. Here and there. That's what we're focusing in on for the, and then of course flexing that head as well. And then for our center of a beam, it would go in between C3 and C4. So for the middle of the spine would be focusing in on there.